the skin, okay, we remove the superficial fascia. Here is the nipple and the areole. This part is going to remember you the position of the mammary gland. We remove the superficial fascia. I'm able to show you the muscle, about the muscle. You should remember the pectoralis major. If I remove the pectoralis major, it is the pectoralis major. If I remove the pectoralis major, behind and deep to pectoralis major, I am able to show you the pectoralis minor. Look at to lateral pectoral nerve, to medial pectoral nerve. The lateral pectoral nerve is going to innervate the pectoralis major. The medial pectoral nerve at the first innervate the pectoralis minor, and at the continue it is going to innervate the pectoralis major. Now here it is the sternum, the supraesternal notch, and here is the costal cartilage, intercostal space. This white sheet is going to remember you the anterior intercostal membrane or the external intercostal membrane, okay? And if I remove the external intercostal membrane, I will be able to show you the muscle fiber that we call the internal intercostal muscle. Now, if I remove, here is the posterior surface of the sternum. The internal thoracic vessel are visible here. The internal thoracic artery comes inferiorly and divide to the superior epigastric and the musculopharynx. And here we have the internal thoracic vein and the artery in each side. This membrane we call the endothoracic membrane. Look at here, it is a valve sheet. Anteriorly is visible and also in posteriorly inside of the thorax. We are going to show you the position of the line, the left and right line, and the covering sheet of the left and right line we call the pleura. Between these two, I am able to show you the mediastinum. Inside of the mediastinum, the heart and covering sheet of the heart will be found. This is the pericardium, and here is the diaphragm. The dome of the diaphragm in the right side is higher than the left side because of the position of the liver. And in each side, I am able to show you the phrenic nerve. It is the left phrenic nerve, but it is not only the phrenic nerve. It is a complex of the phrenic nerve and pericardiopophrenic vessel. So phrenic nerve and pericardiopophrenic vessel in each side. Here we have the pericardium, the outer layer we call the fibrous pericardium, the inner layer we call the serous parietal pericardium. Where is the serous visceral with the heart we remove. So if I find the heart and show you outer layer of the heart, we call epicardium, and in anatomy it is the visceral serous pericardium. Now if I open the pericardium, here you are going to find the inferior vena cava opening, and if such as this cut up, we remove the heart, we'll be able to show you the content of the posterior mediastinum. In the left side, the thoracic aorta is visible. Here the esophagus is visible. So the thoracic aorta and the esophagus. And here it is the left phrenic and it is the left vagus nerve. As you know, the left vagus nerve is going to be continue anteriorly to the esophagus. Here,
behind the root of the
behind of the esophagus, the right phrenic vagus nerve will be. And please remember, it is the phrenic and it is the vagus. The position of the vagus is near the midline. The position of the phrenic compared to the vagus, it is lateral. Now here is the arc of the aorta, and we remove the sternum and all of the structures. So here inside of the superior mediastinum, we are able to find the thymus gland. It is a remain of the thymus gland. In the adult, the thymus removed and it is going to get smaller. And also I am able to show you the internal jugular vein and the left subclavian vein. form the left brachiocephalic vein. In the right side, the internal jugular vein and the right subclavian make the superior vein. The right brachio, both of them make the superior vena cava. And I'm not sure, I come that side to be able to show you another. Okay, here, I'm not sure that you are able to see, but here it is the sympathetic trunk. This is the sympathetic trunk. Okay, this is the sympathetic trunk, and posterior to the